This episode of Healthcare Triage is brought to you by Squarespace. About 2 out of every 3 people will probably experience significant low back pain at some point in their lives. A physician, like me, might suggest any number of potential treatments and therapies, but one I never considered was a referral for spinal manipulation. It appears in that I may have been mistaken. That's the topic of this week's Healthcare Triage. For initial treatment of lower back pain, it may be time for me and other doctors to rethink our biases. Spinal manipulation, applying pressure on bones and joints, along with other less traditional therapies like heat, meditation, and even acupuncture, seems to be as effective as many other more medical therapies we prescribe, and as safe, if not safer. Most back pain resolves over time, so interventions that focus on relief of symptoms and allow the body to heal are ideal. Many of these can be non-pharmacological in nature, like the work done by chiropractors or physical therapists or many osteopaths. Many physicians are traditionally wary of spinal manipulation, in part because some of the practitioners are often not doctors, and also because a few chiropractors have claimed that they can address conditions that have nothing to do with the spine. Patients with back pain haven't seemed as skeptical. A large survey of them from 2002 through 2008 found that more than 30% sought chiropractic care, significantly more than those who sought massage, acupuncture, or homeopathy. Researchers have been looking at the evidence supporting spinal manipulation for some time. Almost 35 years ago, a systematic review evaluated the available research then, most of which was judged to be low in quality, and found that there might be some short-term benefits from the procedure. Almost a decade later, a Cochrane review assessed the literature once more and found 12 new trials had been conducted. This review was more damning. It found that spinal manipulation was no better than sham intervention. But since then, data have accumulated as several higher quality studies have been performed. Recently, in JAMA, researchers looked for new studies since 2011, as well as those that had been performed before. The evidence from 15 randomized controlled trials, which included more than 1,700 patients, showed that spinal manipulation caused an improvement in pain of about 10 points on a 100-point scale. The evidence from 12 randomized controlled trials, which overlap but not completely with the others, of almost 1,400 patients showed that spinal manipulation also resulted in improvements in function. In February, in Annals of Internal Medicine, another systematic review of non-pharmacologic therapies generally agreed with the other recent trials. Based upon this review and other evidence, the American College of Physicians released new clinical practice guidelines for the non-invasive treatment of subacute back pain. They recommended that patients try heat, massage, acupuncture, or spinal manipulation as first-line therapies. The only things that might detract from the use of spinal manipulation in this situation would be its cost and potential harms. Because they fear those potential harms, some physicians are hesitant to refer patients to chiropractors or physical therapists for care. But in all the studies summarized before, there were really no serious adverse events reported, specifically when they focus on the lower back. It's possible to find anecdotes of harm to the spinal cord from improper manipulations, but these are rare and almost always involve the cervical spine and not the lower spine. Some physicians are concerned about the cost of spinal manipulation, especially since most insurance carriers don't cover it. Visiting a chiropractor costs more than taking many non-narcotic pain medications. But more invasive interventions can cost a lot of money. In addition, studies have shown that in general, users of complementary and alternative medicine spend less overall for back pain than users of only traditional medicine. Medication and surgery can also lead to harms. We shouldn't forget that prescription pain medications like opioids can lead to huge costs, especially when they're misused. Some physicians are uncomfortable that we don't have a clear picture of how spinal manipulation actually works to reduce pain. It's also possible that some chiropractors do it better than others and we can't tell. This concern should be tempered by the fact that we don't have a great understanding of why many other therapies work either. Some of the more traditional things we recommend don't even work consistently. Still, there's no merit to many other claims about spinal manipulation, that it's been proved to work for things like infantile colic, painful periods, asthma, gastrointestinal problems, and more. For most conditions, the therapy lacks a good evidence base. But given the natural course of back pain, that most of it goes away no matter what you do, the ideal approach is to treat the symptoms and let the body heal. Non-invasive therapies seem to do that well enough. This episode is brought to you by Squarespace, which lets users create custom websites and online stores. Squarespace is great for businesses and creative projects, and in fact, we use Squarespace around here. They've got templates and 24/7 customer support, so you have everything you need to create your website. Get started by visiting squarespace.com and use the code TRIAGE for 10% off your first order. Healthcare Triage is funded in part by viewers like you through Patreon, the service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank Joe Sevitz and Sam. Thanks, Joe. Thanks, Sam. More information can be found at patreon.com/healthcaretriage.